Hi, everybody. My name is Rachel Abuav. I'm a dermatologist here in Beverly Hills. I have been practicing for almost 20 years. And early on in my career, I became very interested in autoimmune disease. And since moving to the Los Angeles area, I became specifically interested in lupus. So that was in 2010. So throughout these years, I've been affiliated with Cedars-Sinai, and I've seen lots of lupus patients. I've been privileged to work with Lupus LA and be on the medical advisory board for a number of years. So I am here to talk about hair loss in lupus. I talked about hair loss a few years ago, and apparently it was very popular. So I've been asked to talk about this subject again. So I think we'll just get right into it.
Awesome.
Let's see. Not advancing my slides. Is that because it's paused or because I'm doing something
Oh, there
wrong?
we go.
Okay. There, it's working now. Okay, so hair loss is, as you all know, prevalent in lupus. Depending on the studies you look at, between 17 and 85% of patients who have lupus, we'll also call that SLE, have some type of hair loss, and we'll call that alopecia. A lot of times they have multiple types of hair loss at the same time. We do know based on studies and also intuitively, just being a person, that the quality of life is very much correlated to alopecia. And we know that alopecia can be associated with lupus disease activity, but not always, or it can be a side effect of medications, or I'll just throw in it can be unrelated to either. So determining the exact cause of alopecia in lupus patients is really hard. Not all hair loss is necessarily due to lupus, and most of the time I can say that in my experience, the hair loss is actually multifactorial. And finally, treating alopecia in lupus patients is really hard. So what are some of the things I think about when I examine patients who are coming in with alopecia? I want to know, is it a scarring process or is it a non-scarring process? Is it diffuse or all over the scalp, or is it patchy? And what are some of the circumstances surrounding the onset of the alopecia in this person? So is it new or has it been going on for years? What other important factors are going on? Is lupus very active? So always want to look at laboratory studies. Are there new medications on board? For example, has the person received a lot of steroids recently? Has there been a new viral illness? In the last few years, we've come to recognize that COVID-19 infection has really contributed to a significant amount of alopecia. And one last thing to ask is about surgeries. General anesthesia, surgery, or trauma, such as a car accident or intense stress, can also precipitate hair loss. So this is a photograph of me performing trichoscopy. And it really is an art. And as I continue to practice, I get better and better at this. Every year, I learn more and more nuanced findings that I can see with this device called a dermatoscope, that when you put it on the scalp and look at hair, it becomes a trichoscope, hair scope. And so this is the first step that I use, other than taking history, to really start to figure out what's going on with someone's scalp. And trichoscopy is very complicated. And like I said, it is something I'm learning every day. And really using just a clinical examination is really an incomplete examination of the scalp. So in case in point is that while many types of alopecia can look identical to the naked eye, even my eye, and I consider myself pretty trained in hair loss, trichoscopy will allow me to differentiate a lot of times what types or type of hair loss is present. And like I said initially, 2 to 4 different types of hair loss can be occurring all in the same scalp, and that can be very hard to sort through. These are examples of what I might see on trichoscopy, and we'll go through some of the features. But finally, this is not the beginning and the end of the evaluation. Often we'll need a biopsy, but not always, and less often as I become better at trichoscopy will I need a biopsy. So classifying hair loss. This is one proposed classification for hair loss in lupus. Very low power or high power view is lupus specific causes, which would mean that lupus is actively attacking the scalp versus non-specific hair loss that we'll see within a lupus patient, but it's not necessarily lupus causing this hair loss. Then, as I told you before, that we can break it off into scarring versus non-scarring when I'm talking about lupus activity in the scalp. So let's go over the scarring alopecias. This is among the most devastating types of hair loss. We want to identify early and we want to intervene early. So this is what you also know as chronic cutaneous lupus, discoid lupus erythematosus, commonly seen on the face, scalp, and the ears. 60% of DLE patients will have scalp involvement, which means they'll have alopecia. And if it's advanced, you don't really need a dermatoscope to see the findings, and you don't always need a biopsy. And you can see different presentations here, clinical presentation of a scaly patch with hair loss, that on quick examination, you really don't know that that's discoid lupus. Under the dermatoscope with trichoscopy, you can see certain findings. I'll show them to you soon. And then finally, in this unfortunate patient of mine, really advanced disease, it's obvious from across the room, sadly, that that this is discoid lupus. And again, it's really important to determine what's going on very early, even earlier than this, because while it is a scarring process, if you intervene early, a lot of hair will regrow. And if we're not sure, we always biopsy. So here's trichoscopy, some examples. So we'll see pink and white milky areas and then purple dots. We can see dilated blood vessels. We can see these yellowish dots. These are hair follicles that are plugged with keratin. And sometimes you can see red dots that denote the hair follicles as well. And that's pretty specific to lupus. So treatments have been very disappointing for lupus, discoid lupus of the skin, of the scalp. And I just wanted to bring up, because in my previous talk, I think we talked a lot about different treatments, but this year I wanted to bring attention to a drug called anifrolumab. It may be a promising option. Here's a patient represented from a paper that I pulled showing results from anifrolumab. So type 1 interferon is upregulated in lupus, and anifrolumab, which is also known as Safnelo, was FDA approved just a couple of years ago for systemic lupus, and it blocks this pathway. This is a case report with one patient with severe DLE who didn't really respond to prednisone and Plaquenil and a few other treatments, and was placed on Safnelo. And within 7 months, you can see all this dramatic regrowth of hair. And this is why I say, while it's a scarring process, if we catch it early enough, you can actually see significant hair growth, even surprisingly, sometimes when you think it's just scar. And this case report really was from the large studies that were done on anifrolumab, where skin really did show improvement. Another type of scarring alopecia is lupus paniculitis, and it's also known as lupus profundus. Half of the cases have overlying discoid lupus, such as both of these cases, actually. The paniculitis, which is inflammation of fat, it really starts deep in the fat. It destroys the fat, which is why you get these indentations, but it also goes after the hair follicles, which causes hair loss. And so you can see the dents in this and in here where there's no hair growing. And I don't think that trichoscopy really adds much here, because everything is much deeper in the skin. This is a really difficult type of skin lupus to treat, and we do require multiple systemic therapies for it. Okay, so in the non-scarring category, which we call lupus-specific non-scarring alopecias, we have diffuse all over alopecia and patchy. And within the patchy, we have 3 different types. This is the diffuse non-scarring alopecia in lupus. It can be very mild and can be confused with other not lupus-associated hair loss, such as female pattern thinning or something called telogen effluvium, or it can be quite severe, where you're seeing really a lot of scalp exposed, a lot of fine hairs. And here's another example of a patient of mine. On trichoscopy, you can actually see all of these dilated blood vessels, so you know there's inflammation going on. And when you take a biopsy, you actually see the hallmark features of lupus. in the scalp, including deposits of immune reactants in the skin. This is a direct immunofluorescence that we will sometimes use to help us identify lupus activity. And so we know this is direct involvement of lupus inflammation within the scalp, and it shouldn't be confused with other types. Clinically, it can be. Trichoscopic examination might help us hone into the inflammation, but then a biopsy really may be necessary. And this can respond beautifully to systemic therapy and mirror systemic disease activity. So if someone has very severe flare of their lupus, they'll lose a lot of hair. And as you control the lupus and the numbers get better and the patient feels better, months later, hair will grow back, but that's not always the case. And so in the patients who have residual hair loss, even though their systemic disease is very well controlled, it is thought that there's still inflammation residing within the hair follicles, and that will disrupt the hair cycle. This is the patchy non-scarring alopecia. So you can see circular patches, and this can be confused by all of us as alopecia areata, which is a distinct autoimmune disease that is not lupus. However, if you look under the microscope, you're going to see similar, or the microscope and under the dermatoscope, you're going to see similar findings as the previous diffuse non-scarring alopecia. 15% of patients just demonstrate this pattern of alopecia. 15% of lupus patients with hair loss, I should say, demonstrate this type of hair loss. And there's very little literature, very little attention to this type of alopecia. And like I said, it often is misdiagnosed. So we're here at patchy non-scarring alopecia. Again, these are different examples from the literature. And you can see that they're very well demarcated patches. But unlike alopecia areata, which I'll show you later, you can see these dilated vessels and that look pink here. And under the microscope, there's inflammation disrupting the hair follicle and immune reactants deposited. Then the other type of non-scarring alopecia that's more focal is what we call lupus hair, or I learned from Dr. Michelle Petrie to call them the lupus fuzzies. It's the frontal hairline loss that a lot of patients have. They are short hairs, they're broken, and there's actually similar inflammation under the biopsy, which I'm showing you here, and similar inflammation under trichoscopy. And this is seen in many patients with longstanding lupus. This is a very rare type of non-scarring alopecia. So this is also called lupus panniculitis, but for some reason, and we don't know why, this, while it attacks the fat, it doesn't actually destroy the hair follicles. So we put it in the category of non-scarring alopecia. But it can masquerade as alopecia areata, or even a type of hair pulling condition called trichotillomania. So we need to be aware of this so that we don't miss it. And thankfully, the patients who develop this type of lupus panniculitis are not usually sick, and they don't actually meet criteria for lupus. This is a patient of mine, this is posted with permission, who had lupus panniculitis that was more obvious on the forehead, but you can see the hair loss. Her hairline should have been going here. And here's another picture that's unmarked. But she had these patches in her scalp that looked very much like alopecia areata, but it turned out that there was more inflammation, and biopsy showed us that this was lupus panniculitis masquerading as alopecia areata. So treatment, there are lots and lots of treatments for non-scarring alopecia for lupus. They're all, they give mixed results. It is very difficult to treat this type of alopecia. We have to control the systemic disease first and foremost, and then we can target treatment to the scalp. But I wanted to present this paper, which showed some promising results with baricitinib, which is Olumiant. It is a JAK inhibitor. And in this patient here, she had significant patchy alopecia. And you can see in as little as 4 weeks, there was improvement in hair growth, both the length of the hair, but also starting to recruit hair follicles around. And after 8 weeks of treatment, a pretty respectable amount of hair. So again, this is relating to the interferon signal that's elevated in lupus, and JAK inhibitors will block the interferon pathway. and this is the case. I personally have not seen such a dramatic improvement, but it's also fairly new. And so we are putting more and more patients on JAK inhibitors with lupus. And so we'll collect a bigger, data set as time goes on. Okay, so the last section of this brief talk is to talk about the non-specific alopecia that we see in lupus patients. So these are causes of hair loss that can happen to anyone, but they're not due to lupus. They just happen to be in a lupus patient. And we should really make sure that we don't forget about these. I don't have time to talk about all of them. They're not all that important, actually, but the top three, I think, are ones that we have to make sure we recognize and diagnose properly. So alopecia areata is really a distinct autoimmune disorder. 10% of lupus patients are quoted to have this. I think it might be less because I think we may have misdiagnosed our patchy non-scarring alopecia patients as alopecia areata when we weren't as knowledgeable about the trichoscopic features and maybe did not appreciate that we should biopsy more of these patients. So we can also confuse alopecia areata with early discoid lupus. If we indeed decide that this is alopecia areata, we should be looking for thyroid disease. And like I said, trichoscopy and biopsy are helpful. Trichoscopy in alopecia areata is kind of fun. We see features such as yellow dots, black dots. Yellow dots are empty hair follicles with oil or sebum coming out. Black dots are broken off hairs that are broken and fragile because of the inflammation. We see tapered hairs, or we call exclamation point hairs, showing that there's inflammation affecting the thickness of the hair shaft. We find in more advanced alopecia areata things like very fine, short, vellus hairs, so very like baby hairs, and also these pigtail hairs, which are a sign that the hairs are not as strong. So again, I wanted to just bring up an emerging therapy. JAK inhibitors are the hot thing in alopecia areata. That was found accidentally, and in a patient who was treated with a JAK inhibitor for psoriasis, also had alopecia areata and grew all his hair back. And so now we have on-label indications for alopecia areata. And so this is from a paper showing baricitinib or Olumiant for severe alopecia areata and regrowth. I just want to note that this is very, very slow. And so those of us who are impatient to get hair to regrow should not give up too early on these JAK inhibitors. And they do take time. And so we should keep patients on for longer than intuitively we want to. And that's it. I'm going to stop with my prepared statements and open up to questions. Brianna, you can read the questions to me. And thank you very much for listening.
Yeah, thank you so much for your time, Dr. Abuav. This is such an important topic for our community, and it affects so many lupus patients in different ways. So thank you so much for your time. We have some questions coming in, and then some that have been submitted from the community. So let's see. Is it okay for lupus patients to get hair extensions?
So there's nothing inherently contraindicated in a lupus patient in terms of getting hair extensions versus anyone else, but there are some good general rules with hair extensions. If your head hurts when you're getting the extensions put in, or they hurt when you have them in, then I always talk about it that your hair follicles are screaming at you, stop hurting me. So what you're actually causing is a lot of stress on the hair. It's already hair that's prone to inflammation, and you're going to lead to worsening hair loss in that situation. If it's heavy, if it's pulling and hurting, it's not very healthy for the hair. You're going to lose hair, and we would call that a different type of hair loss. We'd call that traction alopecia. And so remember at the beginning, I told you that there can be as many as 4 different types of hair loss in the single head. That could be because somebody has lupus hair loss and they need to camouflage it, understandably so, and they put extensions in, and it weakens the hair and pulls on the hair and gives them a secondary traction alopecia.
Interesting.
Mm-hmm.
Along those same lines, somebody else asked, will wearing a wig make hair loss worse?
No, not at all. So wearing a wig that's comfortable and not too tight on your scalp will do nothing to worsen hair loss. And it's encouraged because no matter what we do, it's going to take time to grow hair. So if wearing that wig gives you the confidence and dignity to be able to interact in society, then wear one. It actually, from my perspective, it's easier if you wear a wig than if you have a sewn and weave, because I have access to your scalp that way to be able to monitor. And sometimes we do interventions. I didn't go into any of that today because we did that in the previous talk, but we might do actual interventions like shots, etc. I can't get in there if there's a weave that's sewn in, it's not removable or glued in. And I will say one more thing is I prefer, if wig is the least traumatic to the skin, a sewn in piece is better than a glued in piece. We don't like the glue. The glue really inflames the scalp very, very much. And also the trauma from the weave, from the glue, when you pull it off, you can actually induce lupus, discoid lupus in the scalp from that.
Oh, geez. Interesting.
Mhm.
So one of the questions that we had, two are similar. So someone asked, are there supplements that will help with inflammation related hair growth while you are, or hair loss while you are ramping up on lupus meds? And someone else, Jenny asked, how do you feel about sulfur to stimulate hair growth? So we're getting questions around, is there anything, it seems like there's interest in,
Mhm.
is there anything natural that anyone can do while pursuing maybe some of these interventions?
Great questions. The hair loss science is so behind everything else out there. So I don't really have good answers in terms of giving you great data to say that any supplements help. Plus, a lot of the hair loss literature studies will really exclude patients with autoimmune diseases, and they'll just focus on the most prevalent type of hair loss, which is androgenetic alopecia, male and female pattern alopecia, age-related genetic
Mm,
alopecia. And so we're
mm,
not really, I don't know that I can really extrapolate for you any benefit from any of these things, really. We try our best. We certainly put patients on some hair loss vitamins such as Nutrafol or Viviscal Professional. There are a few others on the market. Is one better than the other? I can tell you, I don't know the answer. Could they be harmful? Probably not. I mean, if you ask the rheumatologist, they probably will tell you not, that they're not harmful. We don't really know, is the truth. Sulfur, uh, if it's just precipitated sulfur, I think it can act as an anti-inflammatory. Um, I don't think it would do anything to actually reduce lupus inflammation. It's probably too deep and
mhm.
systemic for a topical sulfur to work. It probably smells very bad and uncomfortable. So I don't think compliance would be long lasting with that. But I don't think it would hurt. I don't think it would hurt.
Okay, noted. And we actually just had a question from Amy about Nutrafol, asking how do you feel about it? And we'll link to your previous talk, but do you
Mhm.
mind just quickly weighing in on how you feel about Nutrafol?
I think it's very anecdotal. I think the
Okay.
studies on Nutrafol and Viviscal Professional are all sponsored by the makers of, and again, they're not really um, relatable to lupus patients per se because they're not studied in those patients. So I don't think it's harmful, and anecdotally, there are patients who will say that they're helpful. So I think they're okay to take. They're expensive. There are a lot of pills. Always ask your rheumatologist before you start one just to make sure there's no interaction, just in case I'm not aware of anything of an interaction. Some will say that it helps the hair grow longer, help reduce shedding. There must be something to them in general because they've had good traction on the market. But I don't have any specific studies in lupus to say that they're helpful
Yeah.
or not. But it would be an interest. It would be a hard study to do, is the truth. All hair studies are hard to do. They're hard to track because so much is involved in the hair cycle.
Yeah, that makes sense. Um, could you touch on eyebrow hair as well? If there's like a different approach if people lose eyebrow hair with lupus, if there's any different way to approach that, or is that the same process for looking at treatment as you kind of discussed already?
So it depends on the diagnosis. So if there's an inflammatory component to it, we will very easily give injections. I know it sounds painful, but we do it gently. We give injections of cortisones into the eyebrows. We also do platelet-rich plasma injections.
Oh,
That also, I've been doing that for a decade now, and I treat a lot of lupus patients. Whether or not that is disease modifying remains to be determined. No one's done a great study on that. We don't know. And again, it's so hard to track hair health and loss in a lupus patient. So it's hard to know what one thing might help. But as far as eyebrows go, if there's a scarring process going on, like early discoid lupus, we attack it as quickly as we can with topical injection steroids. We'll, inform, on the systemic medications. We will use PRP. Often I'll do that not just for eyebrows. We will do it for the scalp and for the eyebrows at the same time. And it's been anecdotally helpful, but it's hard to know when you're looking at something so closely what's really helping. And we also tend to do things with multiple treatments all at once because our aim is really to get the hair back as quickly as we can. And so we try to throw a lot of things at once for the patient.
that makes sense. The other question that we have here is, can hormones affect hair loss and menopause if you have lupus? Is this something that you encounter in your practice with lupus patients where this changes during that time frame?
So the answer is hormones in menopause are very much correlated to hair loss, especially in women.
Okay.
And so, we lupus patients get to have all the normal life events like people who don't have lupus. And so a menopausal woman who has lupus will experience hair thinning if it's genetically determined for her, like anyone else. It's just that sometimes you add insult to injury. If you've already starting with thinner hair because of lupus, and then you put menopause on top of that, you can see worsening hair loss. So, absolutely. Does hormone replacement therapy preserve hair? Many women with lupus can't go on hormone replacement therapy, so it's not an option. And we don't have good data for hair really objectively saying if you go on HRT, you will have a denser head of hair. These are great areas to study if possible, but I don't think we have any good data for that. But a lot of anecdotal feelings about it, but I'm not sure that it's really true.
Okay. Thank you so much, Dr. Abuav. That's all of our
Welcome.
questions. We
Great.
so appreciate your time. Thank you for coming
Mhm.
back to share with us.
Thank you for having